Welcome, everybody. Thank you for joining us today for an exclusive, immediate, exciting look at the global healthcare landscape brought to you by HolonIQ. My name is Bethany Hogan, and I'm the Vice President of Client Experience here at HolonIQ, and I'm joined by my colleague, Vernon Baxter, who's the Vice President of our health team. Hey, Vernon.
Hi, Bethany. Hi, everyone. Thank you for tuning in.
So, Vernon, I know that you and I talk about this subject quite a lot, as do so many of us here at HolonIQ, but I'm really excited today to be able to have a more formal dialogue, a deeper look under the hood at specifically everything that went into our newly launched global healthcare landscape and how that fits into HolonIQ's way of working and process and the intelligence that our client community and so many stakeholders rely on. So just to set the scene a little bit before we jump in, for anyone who is perhaps less familiar with us or hasn't maybe seen some of our taxonomies before, really before HolonIQ does anything, we really believe in mapping, contextualizing, and building a kind of deep shared language across that segment. And that's why so many people rely on us across the impact economy, which we define as health, education, and climate, to really understand those connected, constantly evolving pieces and where they're going. So this open source taxonomy we're going to walk through today is one of three, and it's an ever-evolving process, frame of reference, et cetera. But the idea is that it's shared language, it's shared context, and it's something that folks can refer to and understand as they look at a really rapidly evolving space such as healthcare. Throughout the session, we do invite you to share questions. We have folks tuning in from all over the world, customers, stakeholders, partners, you name it. So do reach out. There's a question box in the bottom right-hand side of your webinar. So do share questions as we go, and we'll do our best to get to them as we're moving. And we will send a recording of the session after this concludes via email. So have a look out for that. Okay, so in also true HolonIQ fashion, we like to contextualize things and build frameworks. We also like to move through a really in-depth agenda quite quickly. So I'm going to move right along to that. Today, we're going to hear from Vernon specifically about the really in-depth 4-month plus process that's led to the building of this framework and what kinds of stakeholders were involved and what kinds of inputs we used to build it, the process by which we built it, bottom up and top down. We're going to get a really good deep dive into the taxonomy itself, how it's segmented, the thinking behind it, and just, a view on how Vernon specifically is seeing it. And then also really excitingly, look at how that's applied, right? Thinking about our Healthcare 1000, other market activities, how the taxonomy can be used as a really valuable tool to contextualize and understand and just see a market in a new way. But before I hand over to Vernon to walk us through the background, for anyone who is less familiar with us, and specifically special welcome to our customer community, just a bit about HolonIQ and how we're leveraged every day. We are the world's leading impact intelligence platform, and we're really proud to be the backbone of so many important strategic decisions that happen across impact, be that health, education and future of work, climate, impact investing, you name it. I like to sort of shorthand our customer community as anyone who's a doer within this space, right? Folks who are building innovative technologies or innovating in what they're offering in the spaces, folks who are investing in these spaces, forming really important strategic partnerships, policy, you name it. But generally speaking, our customer community uses us in these 6 key ways. What's happening in the world around me? How is it shifting and how am I positioned within it? How big is this market or ones nearby it? Where is it moving? What are peers doing? Who should we be working with or investing in? How do we power transformation digitally across the space? So clearly a lot in there we could spend more time on. But if you're interested in learning more about any of this or how our customers leverage us or what kind of intelligence we provide, definitely do reach out because there's lots to share there. Okay, Vernon, I know there was a lot that went into this. Why don't you talk us through the methodology and how the last few months have been going?
Yeah, thanks, Bethany, and welcome everyone to this webinar. As Bethany's already said, building a taxonomy is a sort of a massive undertaking that we've been working with our team, the Health Intelligence Unit, and the wider HolonIQ team, and also external partners. And I'll come on a little bit to talk about how we've run workshops in other parts of the world and how we've engaged with stakeholders to build this taxonomy. But I think maybe before we do that, it might be useful just to sort of talk for a little bit about why we do it. Because I think, you know, if going back to the kind of quest of HolonIQ to try and bring structure and meaning to sort of complex and evolving ecosystems, I think if we just go to this next slide, which shows the health taxonomy in the context of the other taxonomies that we've built so far, I think before we dive into this sort of the detail of the health one, it'll be useful to talk about what these taxonomies allow us to learn, what they allow us to achieve with the data that we're able to take out of them, and also some of the challenges that go into kind of coming up with the structure. So I think with all of these sectors across climate, education, and healthcare, there's almost an endless amount of complexity. And I think in pretty much all of these sectors, there's a high degree of localization, a high degree of specialization, and actually trying to get a picture of what's going on in these sectors is often very difficult, especially cross borders, cross geographies, as terminology can vary for essentially very similar aspects of sectors. So at one very basic level, what our taxonomy does is it allows us to bring a kind of common structure that allows us to kind of map, track, analyze, slice, and dice the sectors that we focus on. And to do this, and I'll come on to the kind of two methods that we've employed, there's kind of a lot of fundamental elements of kind of data analytics, but also of kind of conceptual sort of design and structure. And we'll come on to those shortly. But I think, you know, just to go back to the why do we do this, I think in all of these sectors, you know, they're hugely important, hugely established institutional sectors where there's kind of been a great degree of sophistication, but there's also a huge degree of disruption. And we'll talk about this a lot as when we go into the taxonomy itself, but these sectors are changing literally by the day, by the month, by the year. And what these taxonomies allow, and as Beth said, they're open source, they're evolving. We work with people to update these. I think education is on the 4th iteration. Is that we're allowed to kind of capture in real time the change in dynamics of these sectors. So just quickly going on to the methodology, I won't spend too much time on this because if you're a fan of HolonIQ, and I know there are many on the call, you will understand how we kind of go about these kind of processes. But also, I really want to kind of get into healthcare because it takes a while to unpack. So the two approaches I would say that we have are bottom up and top down. So going back to that point about what can data tell us, and then secondly, what can, I suppose, intelligent design bring to the thinking behind the taxonomy. So essentially, our platform, which is powered by machine learning and huge sort of power that, you know, an individual wouldn't be able to bring on their own, allows us to surface through the analysis of literally tens of thousands of organizations, allows us to surface sort of patterns in the data. And we're able to examine these kind of patterns against existing taxonomies, other maybe industrial ways that they were previously categorized and considered. But by doing that process, we also get to see where the old rules for classifying these sectors are put under stress, where there's blurring between segments, and also where there are new categories that quite simply wouldn't have existed 10 years ago, might not even have existed 5 years ago. So by building a sort of taking a bottom-up approach, we're able to kind of see through the data where that heat map of energy is in the sectors that we follow. So I'll come into this in more detail, but essentially, you know, these are the 10 subsectors or areas where the organizations in healthcare that we ultimately group them into. And so I'll come back to some of the thinking that went into that as we go through it. But essentially, the second element of how we approach this is the top-down approach. And I think a lot of what we do at HolonIQ can be summarized as a blend of machine intelligence or artificial intelligence, machine learning, but also human expertise and harnessing industry experience, harnessing expert insights. And again, with everything we do, it's not about an individual, it's about trying to get the greatest sample size possible and the greatest number of inputs and really kick the tires on the concepts and the ideas that we develop. So partly how we've done this is through our own experience, the experience of the team, the experience across HolonIQ. But we've also been really lucky to work with an amazing global network of experts from across healthcare. And I know some of them are on this call, and I just want to also just say thank you for the invaluable kind of input through the sessions that we ran and the kind of feedback we've had. Because I think for any sort of taxonomy to be useful, it has to be able to take into consideration not just what the data tells us, but context. Where is the sector going? Why is it arranged in the way it is? And I think in healthcare, that's particularly interesting and particularly restrictive sometimes in the way that healthcare function and develops or doesn't develop or lags behind the curve. And I think one of the other aspects when we were building this taxonomy is that we had to think about the ways in which healthcare was changing. So there were breakthroughs, both clinical and operational, and in terms of diagnosis that we'll talk about, that I think will fundamentally change the way that money flows through the system, the way that people are treated, and the way that we fund and regulate healthcare, which is obviously a huge element. So just quickly, as I alluded to, we've been running workshops in New York initially to kind of get us started with some basic frameworks and ideas. And then secondly, in London, where we had an amazing workshop of experts from that market who were able to help us build some of the kind of core principles of the taxonomy. And this last picture was taken in June in Sydney, where we had a fantastic collection of experts from the Australian healthcare sector and really kind of global experts walk through the first iteration of the taxonomy. And if you look very closely, you might see that there's a couple of changes between this one and the one that I'm about to show you. But that's probably all I should say at this stage about process, because we could probably use up the whole allotment talking about how we've made it.
One quick question though, while we are on process, first off, I know you racked up quite a lot of air miles in the span of a few months there, and hopefully got really good at packing suitcases and things. But I am curious, as a reflection, were there any comments from the workshops that surprised you? Or I guess I'm really particularly interested in, were there thematics that varied between different ones, like things that were more prominent in New York than say Sydney, which I'm sure we could spend a whole thing on. So I don't mean to get too deep down a rabbit hole, but I think reflective of the really different systems, of course, that folks' perspectives are coming from, right?
Yeah, and I think it's a really important question because it's sort of fundamental to how we've got about building the taxonomy, is that in some ways it's almost easier to be more complex and it's harder to be simple when you're building these, because the concept of a common structure sounds straightforward, but when actually you find healthcare and healthcare systems, and specifically how they're funded and regulated, tends to be hyperlocal. So actually, really, a lot of the difficulty in building a taxonomy is about finding terms that translate cross boundaries, but also some of the other big questions that will come up, and I'm sure I'll talk about this as we go through the taxonomy, is how to treat the disruptive or changing forces that are I suppose, essentially transforming the way that these systems work. And I would say the very obvious example of that would be the role of technology, and specifically video technology, that we've all become so reliant on. And I think we made some early decisions about whether or not digital was its own thing in healthcare, or actually is digital just so inherent that it really lives in every part of a healthcare taxonomy. And I think ultimately that's the conclusion that we got to, going around the world and teasing out, I suppose, the universal challenges and the universal similarities in the systems. A lot of it really boiled down to issues of cost, access, or quality. And probably the biggest, especially in the kind of US, UK, and most of the Western systems, probably the biggest issue really is productivity. How do we get our systems to work better and work sustainably? Because I think pretty much every cost projection, for healthcare systems in the Western world show us going bankrupt over, a short period of kind of 10, 20, 30 years. So massive challenges and similarities, but yeah, really interesting process. And that quest for simplicity is much harder than it sounds. And yeah, just one example of that, if you take medical devices, for instance, there's, I think, 7,000 types of classifications of medical devices and more than 2 million registered medical devices. So, that one tile that we're going to come on to representing medical devices has to do a lot of heavy lifting, but it's kind of a necessary element of building a structure like this.
And something that applies to all three of our taxonomies, right? It's this kind of funny paradox of you're trying to map something that's as rooted as an individual's experience or life cycle. Not that it's only one person, but you can get kind of to the human level granularity, but then you're also trying to balance that with complex systems and changing dynamics. So it's kind of a funny world to sit between. All right, I know everyone's waiting, so I'll stop asking you questions. Why don't you take us through the taxonomy?
Thanks, Bethany. Well, actually, in some ways, that was a very useful segue because, that individual's experience of healthcare is fundamental really to how we kind of built the taxonomy. And I'll come on to the kind of structure shortly. But I think, an obvious thing to say about healthcare is it's something common to our other impact sectors that touches everyone. Everyone has an experience of healthcare. It's fundamental throughout their life, throughout their family's life, and also throughout whichever society they reside in. How that is structured, funded, regulated is a massive part of government's role, hugely political element. So when we started thinking about a taxonomy that represented the organizations involved in healthcare, we had lots of different structures that we played around with, lots of different concepts in terms of how you might sort of go about arranging this. But actually, where we landed is if you look at the top 10 rows, prevention through to research, essentially these are the subsectors, the top 10, the top rows, the 10 subsectors that we decided to arrange all these organizations in. And then at a more granular level, you can go down to the clusters for each. So in most of these subsectors, there's kind of 5 clusters, and a few there's 4. And if you look at the left-hand side, or from prevention through to workforce, I think one way to consider the taxonomy is that left-hand side, or the first half of the taxonomy, really represents our experience of healthcare as individuals and how humans both are involved in healthcare, and from personal or societal or organizational perspective, and everything through from our own personal health through how do we actually deliver healthcare, how do we train healthcare workers, massive issue that we'll come on to. So the left-hand side of the taxonomy I like to think of as the human element of healthcare, and then from systems through to research, this really represents all the kind of technology, the hardware, the products, the science, the medicine, the amazing sort of innovation that's going on, and really that kind of distinction between the human element of it and the kind of product side of the healthcare market was a really early sort of decision that we made that helped us to bring clarity and structure to the types of organizations, and also the relationship between the two sides of the taxonomy. So just going starting on the left and kind of working our way through, the reason why we made a decision to start with prevention is that it's one of the probably the earliest tenets of healthcare policy, is that prevention is better than the cure. And the irony pretty much of global healthcare systems is almost no healthcare system globally has been able to actually live up to that kind of mantra. Essentially, the configuration and the funding of healthcare globally is really to treat us when we get sick rather than to prevent us becoming unwell. But that has, and this is potentially one of the silver linings of the pandemic, is that there's been a massive response over the last 5 years, 10 years, particularly from the commercial sector, from the B2C market, and particularly from technology and from other areas of our kind of commercial world, where people are realizing the importance of personal health. And I think this strange period we've been through over the last 2.5 years, where we've all been testing ourselves, we've all been monitoring sickness levels, we've all been monitoring infection levels, has really sort of brought home to people the importance of personalized health. So the organizations in that first cluster are those who are focused on prevention of health. And I think one of the other key learnings from the last 2.5 years, and I think that you see this across society, is that mental health is inextricable from physical health. And I suspect this has always been the case, but it's certainly much more prevalent in policy and in funding and from the work from across workforce and generally society, that the maintenance of good mental health is absolutely fundamental to the productivity and good health of a society. So just quickly going through prevention, we thought mental health is so fundamentally important that we wanted to start the taxonomy with that, and all the organizations that are doing amazing work there. Just one quick factoid on mental health is, as we come out, as telehealth usage has broadly sort of plateaued or in some places dropped off, as we sort of have returned to more face-to-face interactions with healthcare systems globally, mental health is the one area still that is growing considerably in terms of usage and uptake of telehealth facilities. So we'll come telehealth technology. But quickly, prevention, we look to capture mental health, well-being, physical fitness, and obviously a huge element of physical fitness is, or a huge correlation is nutrition and supplements. And that is a massive area, and especially in kind of Western markets where obesity levels are literally creating massive problems for healthcare systems. And we also, the other area that we think there's amazing stuff going on is in remote monitoring. So this is really the ability of healthcare professionals to receive information that identifies early episodes of diseases and intervenes in ways that sort of vastly reduces the healthcare cost and the severity of the incident. And in some ways that's very related to diagnosis, and it was a kind of big sort of decision where to put these two. But I think the diagnosis subsector, again, is fundamental to the capacity and the effectiveness of any healthcare system, is how quickly and efficiently and accurately can it diagnose what's going on with its population. And so the traditional kind of pathology companies, hugely important, really been put under stress over the last 2.5 years. But also we're seeing lots of technological innovation there. And point of care testing, our next tile, that's really people who are bringing testing closer to the individual and trying to remove some of the kind of costly apparatus and pathways that require to turn around diagnosis. And likewise in diagnostic tech and decision support, we're seeing people really bring modern methods of analytics and AI and machine learning to really sort of disseminate effectively better and more accurate decision making about what actually ails us. And I think that's hugely interesting area, because if you look at the shortage of healthcare professionals, which will come into workforce, is that there simply isn't enough people to treat the kind of world's population. But can we rely on technology and advances in technology to better and more effectively treat people? I think we can, and we see some amazing businesses that are leapfrogging that whole kind of infrastructure that you need. So in treatment and care, really this is the healthcare services organizations that deliver healthcare to us as individuals. And I think there's a few tiles that I'll pop out that I'll pick out for this. Telehealth, it was an interesting one to decide whether or not telehealth and the various ways that it is administered and used, whether or not that is its distinct cluster or whether or not that is simply part of healthcare now. But I think given the rapid uptake of telehealth globally, and also pretty much when we look around the world, and the last 4 months I've probably looked at more than 10,000 deals globally, there's been a massive growth in every region of telehealth players that are focused on their geography, their systems, and so we decided to parse that out as a distinct category. And likewise, I'll pick out, just because we don't have time to go into absolutely everyone. In care, I think chronic care and aged care are two clusters that are particularly important as we go forward, because I think that's care is distinct from treatment in that it's an ongoing sort of situation where an individual will probably be living with a kind of a vulnerability or a condition for typically the rest of their life. And so in chronic care and aged care, I think, a very pertinent and important example of that to pull out would be something like dementia, or in chronic care, in particular diabetes, where these hugely costly conditions that require kind of ongoing management. We're seeing amazing sort of advances in both how they're diagnosed, how they're maintained, and how we can kind of keep individuals from escalating up the healthcare cost curve. So just quickly on workforce, I think anyone in healthcare will be aware of what a challenge it is globally to actually staff healthcare services at the moment. I speak to a lot of execs of healthcare services companies, and pretty much that's the number one headache at the moment is staffing. And you look at the World Health Organization's projections, and essentially, give or take, and I think this study was done pre-COVID, and I think factors have probably exacerbated this, but the expectation is that somewhere in the region of 20% of all healthcare positions are likely to be unfilled or vacant by 2030. And that just gives you a sense of the supply-demand imbalance that we're seeing in this kind of market. And so the organizations that responded to that through training doctors, training healthcare workers, training caregivers is a really dynamic part of the market. And obviously we work a lot in education, and we've seen some amazing organizations start to respond to this. But also I would say that globally, governments are probably behind the curve in terms of recognizing the funding that is required for that. So as we come to the second half of the taxonomy, again, looking at the kind of systems through to research, this is really, as I said, the technology, the products, the medicines, and the other sort of ancillary services that healthcare requires to be delivered effectively. And actually, looking at this section, this is probably where a lot of the opportunity is to kind of drive productivity, because currently this is where a lot of the cost resides globally. So in systems, I think it would shock no one to know that healthcare is notoriously poor when it comes to its use of data architecture and data infrastructure. Lots of good reasons for that in terms of the primacy of privacy concerns in healthcare, but also often the siloed nature of how healthcare is delivered means that the systems, simplistically often don't talk to each other. So we're seeing some amazing businesses growing incredibly quickly across areas like practice management and booking and referrals and health analytics, where we're able to bring some modern techniques and modern concepts of how information is gathered, stored, and moves through a system to improve what, frankly, is a kind of often a creaking part of the healthcare system. I think this is also really interesting. If you look at the developing world and other kind of parts of the market, other parts globally, is that there's a massive opportunity for continents that don't have some of these challenges to almost leapfrog developed systems by smart adaptation and smart application of technology. In hardware is a huge area for expense in healthcare. And, we're seeing through the kind of product innovation and technology innovation, a whole new generation of devices and connected health that tells us through wearables and through other monitoring systems kind of what is going on with our own bodies and communicating that to healthcare systems. And obviously that's very closely tied to prevention and diagnosis, but we made a decision that wearables, as defined by a kind of clinically led device that has been developed for healthcare purposes, lived as a natural object in hardware, whereas the kind of more general sort of advances that have been made by sort of people like Apple Watch, for instance, or the software or the kind of firms that are taking the information collected by wearables and building lifestyle propositions around software. We think that resides over in prevention and diagnosis. So just quickly going through hardware, also medical equipment, medical imaging, massive areas of expense for healthcare systems, and also massive areas of opportunity, because more advances in technology, advances in the efficacy and the kind of productivity of these parts of hospitals is an amazing way to kind of make systems more robust. Medical robotics, we decided that could have lived inside one of these tiles, but we wanted to parse it out because it's just such an exciting area, and you know the potential there and the investment that's going into it, into that whole concept of automation is really kind of an area we want to keep an eye on. Just quickly on finance, you know, obviously healthcare requires a massive industry to administer it, to fund it, and every healthcare system functions slightly differently. Broadly speaking, typically they're either an insurance-based system or a tax-based system, or some combination of both. But that whole administrative element of healthcare is a massive, at one level, cost to healthcare as a system, but it's also a potential for innovation, potential for redesign of care pathways and clinical delivery of healthcare. So amazing stuff that's going on in that whole area, and sort of insurtech and health benefits, particularly in the US market. In the final two subsectors I wanted to talk about, because there was a kind of big discussion about how to treat, I suppose, the two elements of let's say drug and clinical production of medicines. I think, without getting into a long discussion about the pharmaceutical world, because we frankly don't have time and it's a massive topic, the whole model really has shifted over the last 10 to 15 years about the way that the role that pharma plays and the way it sort of functions in the market. And really, pharma has almost become like a commissioner of innovation, and the actual kind of IP and a lot of the sort of individuals who are driving breakthrough technologies, breakthrough medicines, they function outside of that world and almost act as kind of a feeder to the big drug producers. So we wanted to parse out drug production, which could be seen as a byword for all the medicines that we already know, through to the kind of world of discovery and precision medicine and clinical trials and clinical insights, which are really the individuals that are inventing, or the organizations and individuals that are trying to solve some of the problems that we don't even know how we're going to do it yet, but we know that it has to be done. And so you look at the people driving solutions in oncology or dementia or neurodiagnostics, that really is the research subsector. And we wanted to capture that energy and that sort of intellect that's going into changing the future of healthcare. So I know I missed a couple of tiles, and you know we might have time to come back to some elements of it, but I wanted to kind of give you a sense of the structure and also why we've kind of made some decisions along the way. And hopefully that makes sense to everyone who's on the call.
Vernon, thank you for taking us through that. I think, you know, it's obviously such a vast and complex ecosystem to go through, which could certainly take hours if we really wanted to. But I think, you know, that kind of quick synthesis is a really helpful way to give us a view of what's happening and thinking behind it and how it's connected. But certainly, I hope folks will get a chance to pour into this a bit more after the session. There's lots of resources on our website, holoniq.com, too, to have more of a look at this. And I'm pretty sure we'll be sharing the link to this open source taxonomy, www.globalhealthcarelandscape.org. I'm right.
.org.
Yes, perfect. Wonderful. So I think to close us out, we've just looked at this really hefty piece of thinking, right? Can you walk us through how you're thinking about applying it to information you're seeing in the platform and more broadly across the ecosystem? And yeah, just share a bit more about how folks can think about mapping it to things going on in the market.
Yeah, thank you. And I'll go through this relatively quickly, but I wanted to kind of end by showing again, going back to the question, why build a taxonomy? And building a taxonomy allows you to kind of see a sector at a global view, but also to see the granular ways in which it evolves, it changes, and where the sort of entrepreneurial and investment energy is going into the market. And I think a great example of this, and I'll be relatively quick because this information, as Bethany said, is on our website and can be consumed at kind of a more leisurely pace. But essentially, what we did once we landed on our taxonomy 1.0, and just to reiterate, now that I've been through the taxonomy, I would love any feedback through our Creative Commons open source function that we have on the website. So, suggestions, improvements, future amendments, all those sort of things would be fantastic. But one of the first things we wanted to do was apply it to some of the data sets that we had built ourselves. So in 2021, HolonIQ's team built an amazing database of essentially the top 1,000 health tech startups globally. And so this is an amazing list. Again, you can check it out on the website, and you can see last year's market maps for each of the geographies that we cover, which are split globally. We're also kind of in the process of doing this for 2022 as well, but we're not quite finished yet. So what we did is we looked at that top 1,000 health tech startups map, and we put them through the prism of the taxonomy. And what you can see here is effectively the 10 sectors on the top, and then below each of the prevalence of the clusters that we've identified. And so obviously, like the list is, I suppose, skewed towards what constitutes tech startups and what they focus on. So for instance, workforce is not particularly well represented, but that probably is an area that doesn't often lend itself to this sort of energy. Whereas if you're looking at health records, booking and referrals, medical devices, telehealth, clinical insights, this is really where a lot of the amazing organizations that we collected as part of that process are being categorized and mapped against the taxonomy. So here's one quick example of what this kind of graph can tell us about what's going on in the market. But also, there's lots of different ways you can cut using our system and the taxonomy to slice and dice where that sort of tech innovation and that entrepreneurial zeal is going. And so looking at this is effectively another way of looking at just the subsector view. So as you'll see, sort of research is I wouldn't say dominant, but it's the largest section of this, pretty closely followed by systems and diagnosis and prevention hardware, all quite similar sort of parcels. And I think what's interesting as we sort of dive into the cluster view on the next slide is that you're able to kind of sort of double click and get into the data and understand where the I suppose across the subsectors there's commonality, but where there's also differences. And I think, for instance, if you take medical devices actually is probably it represents the largest cluster by volume across the health tech 1,000. But I think that's actually really kind of characteristic to what medical devices are and how they're developed. And I referenced it earlier in the webinar, is that essentially it's novel IP developed to solve specific problems, and often spun out of universities and or particular technological kind of breakthroughs. But as you go down through the other, I think this is the top 10 of the kind of cluster view, or top 20 cluster view, you can kind of get a feel for where that sort of energy is going. And also, because of the way that we collect the data, and here again, I'm just racing through this, but it's another application of the taxonomy, is that we can see how that differs by geography, as well as by kind of cluster or by subsector. And I think it's interesting looking at the different emphasis across the markets, and in, broadly speaking, how technology and systems in some markets are hugely important and hugely are like real areas of potential kind of growth, broadly speaking, because they're systems that really require reform and really require efficiency gains. Whereas in other markets that don't have that, you start to see treatment and prevention and diagnosis really sort of coming to the fore as startups that are really getting traction. And then just finally, again, another application of the taxonomy and of our kind of platform is you start to get a sense of the kind of age and stage of a lot of these kind of health tech startups. So, and this will be really interesting to repeat during 2022. And, I think as an early cut of the data, I'm already seeing that the period of the pandemic has been really rich in terms of innovation and technological advances. And I don't think this really came through in the 2021 data in terms of the amount of money that's been raised by businesses that have reacted to the problems that COVID presented. But again, by being able to slice and dice, you start to see the patterns. I'm sure when we do this chart relative to the 2022 cohort, it's going to be fascinating to see how the age of startups has changed over the last sort of 2.5 years. But I just wanted to kind of quickly show you that, and I think better consumed on the website at your leisure. But essentially, there's a living, breathing example of what you can use the taxonomy for, and clearly we've got grand plans to use it for much more and on an ongoing basis as it kind of powers our platform going forward.
Excellent, Vernon. Thank you so much. That was really interesting. And I definitely want to go back through those numbers at the end of the slides and pour over them a bit more. And we definitely encourage everyone on the call and everyone listening after to do the same. Thanks everyone for joining us. As Vernon said, this is the beginning of a lot of things from us on this topic, and part of an ongoing conversation that certainly predated this conversation. So do keep a lookout for more. We've got a lot coming from our health intelligence unit on some analysis we're doing in the market. This taxonomy will certainly be very prominent in that work, as well as our upcoming summit series, which begins on September 22nd in New York City and goes truly all over the world in 100 days, 13 locations plus virtual. So we hope we can see you in person in the coming weeks and months. Also, lots more coming from us on ways to access this through our platform and other intelligence from the team. So if any of that sounds interesting, don't be shy. Do reach out with any questions or follow-ups. And yeah, hopefully see you soon.
Yep, thank you. And look forward to any feedback and suggestions as we move towards Landscape 2.0 next year.
Perfect. Bye.